No, it's fine.
Okay, there you go.
Okay, so we're going to review some things for the midterm for next week. You will do just fine. You just need to study, that's all. Okay. I need you to name me 3 parts of the patient care partnership.
High quality care.
Yes. 3 parts of the patient care partnership. Empathy? No. But, yeah, that's nice. But to have empathy, but that's not one of the patient care partnership.
I've gone over
It's
this.
in my notes and I'm really trying not to look at them.
Improvement in your care.
High quality hospital care? Yes.
Confidentiality.
Confidentiality? Anything else?
Yes, we know what we need to study.
Yes.
Yes.
Do care?
I'm sorry?
Do care? Like just
Well, that's kind of high quality hospital care. There's also protection of privacy, yes.
involvement in care?
Involvement in your care, yes. Help with billing claims and help leaving the hospital. They'll just kick you to the curb. Somebody will. They won't. Oh yeah, maybe some will. I don't know. Hopefully not. All cultures go to which department?
Microbiome.
Yes. Not, well, it's, yeah,
Like
All
You're right.
cultures go to
microbiology.
biology.
You're right. Which part of the lab would you find toxicology?
I put down like urinalysis, but I don't know.
Chemistry. It'd be chemistry.
when you find
To
what?
fix
I'm
that.
sorry. Which part of the lab will you find?
Toxicology would be chemistry. Which consent is consent that is given verbally or in writing for high-risk procedures, surgery, or experimental drugs?
Informed.
Not implied.
Yes, expressed.
Expressed.
3 blood tests that are run in the chemistry department. Any 3?
Drug analysis.
Toxicology.
Yes.
RBC?
No.
Oh, wrong one. Wrong department, just kidding.
What?
Wrong department.
Yeah.
Just kidding.
Is it like glucose?
Glucose?
Drug.
What was the
Forgot.
question?
Drug analysis.
3 blood tests that are run in the chemistry department.
Glucose, drug analysis, and then
Analysis?
Yes, you can do, yes. That works.
there's one more. What?
Oh, I know that.
What about comprehensive metabolic panel? That works.
And CMP is fine, right?
CMP is fine, yeah. Cholesterol.
Oh, that's what I was missing.
Cholesterol, what else do you have on your list?
Electrolytes, is that the one that goes from?
Yeah, electrolytes. Yes,
Try to get basically follicle panel?
yes. Or BMP, yes. That is correct. Name 3 tubes that clot and produce serum.
SST. PST. Wait, no.
No PS.
Red.
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 Red, and then coagulation.
And the camel red and, are we still thinking or?
I don't know, are you all thinking? What about navy blue with nothing in it? Well, that's gonna clot, right?
Yeah.
Okay. The process of identifying an organism and determining the appropriate antibiotic for treatment is called. The process of identifying an organism and determining the appropriate antibiotic for treatment is called culture and sensitivity.
Culture.
Malpractice is a type of blank committed by a professional.
Negligence.
Yes. Name 3 of the 10 guidelines to avoid lawsuits.
Acquire consent before you draw blood. Use appropriate equipment.
Okay.
That is one.
There's a bunch of them. There's 10.
What was the one, I'm sorry, what was the one right before name 3 of the 10 to avoid?
Oh, name 3 of the 10 guidelines to avoid lawsuits.
No, but the one before
Before
that.
that.
The question right before that?
Oh, the process of identifying an organism.
No. There was something right after.
Oh, three tubes that clot and produce serum.
No, that was right.
Oh my goodness.
No, the malpractice is a type of negligence.
Yes.
Oh, you meant, I think you meant question. I'm sorry, not answer.
Can you tell me the question again, please?
Yes. Name 3 of the 10 guidelines.
No, not that one.
Oh my God.
The malpractice one?
Yes.
Sorry.
That's okay. It's me.
Malpractice is a type of blank committed by a professional. Sorry.
Because you probably need to laugh and release some tension anyway.
Yeah.
Thank you.
You're welcome.
This is why I use a tape recorder.
Right. I know.
So you can laugh at all this later. Okay. Name 3 of the 10 guidelines to avoid lawsuits.
Follow listed procedures, listed guidelines.
Yes. Yeah.
Are these
Is there a
going to
better
be
way
fill
to
in the
put that?
blank or?
I mean, that works. I don't know. You kind of have to look at the guidelines, and because they're worded specific, but
Respect the right of patient to reject.
refuse.
testing.
Refuse testing.
Refuse testing.
Yes. It's not on here, but yes. I don't think that's on here. It's not on here. It's not on my list of 10.
Shame on you.
I know, but I'm like, yes, that would work, but
Would it count on the test?
probably not.
Okay.
But that was a good one. It should be 11. 11 guidelines.
Until we're official, it'll be 15.
Yeah. By the end of class, there's like 30. Yes, Brianna?
I was gonna say, listen and handle the patient with appropriate care.
Yeah, you just really need to look at the lawsuits, that box. I'm not sure what page it's on, but it was chapter 2, I believe, was the laws and torts and all that. So I'd go back there and just look at that. What are the 8 tests?
57.
Page 57. What are the 8 tests in a basic metabolic panel?
Just looked at that one today too.
Glucose, calcium,
Potassium.
CO2, potassium,
Bun.
bun,
Creatine.
Creatinine.
Can't. I
How do
keep
you pronounce that?
mispronouncing that.
I don't know if I said it
Creatine
right.
was in there.
That's what I meant.
yeah, creatinine, creatine, I don't know. That's either way. I say creatinine, but I don't know.
That's probably right.
But it doesn't mean that it's right. How do you say it, Jessica?
What?
How do you say it? Creatinine or creatine?
I say creatinine.
Okay, I do
Some
too.
people say, no, that's creatinine. Yeah.
I think that's what it is.
Because there is a creatine, but that's not the same thing.
Something.
That was like what's in the
hair
bodybuilder stuff, right? When they take that.
Oh yeah, it is. Yeah. Oh,
It's two different things, creatinine
Right.
and creatine. Creatinine is different than creatine.
yeah, they're not the same thing. But I think I've heard people pronounce it.
Yeah, they say it differently. What do they say?
This creatine? It's a powder that you put in bodybuilding. It builds
Builds muscle or something.
mass.
So if you have too much of that in your blood,
No, that's not good.
Sodium?
like steroids?
Sodium.
Steroids are a whole different.
Fluoride.
Chloride.
That makes your head big and your woohoo small.
Well, we definitely don't want to do that. Okay. 4 parts of a CBC.
The test,
The 4 tests.
hemoglobin, hematocrit, red blood cell count, white blood cell count,
And one more. No.
Platelet?
Platelets.
platelet.
And real quick, this is Jessica back here. I'm sorry I forgot to say. She'll be taking my class. She'll be taking over you guys when I'm gone on vacation. Week 6.
Yeah, and we're gonna be doing what chapters? What chapter?
I don't know.
7 and 8?
7 and 8. Yeah, that's
I
right.
haven't looked up. I should just know that.
No, it's okay. I looked over it yesterday just to make sure I don't let you guys down.
You won't let them down.
What was the difference? HCTH,
You sure she has a
platelets,
T?
and
Yeah, I'm gonna make sure I have a
platelets. RBC and WBC. Oh my goodness.
Luckily, they're easy chapters.
it's not.
Oh, good.
Oh, HCT and HCTV is one test, right?
Yes.
Oh, that's right, we really went through it.
Okay. Blank means that patients grant permission by means of signs. Their actions indicate consent.
Implied.
Intent.
Implied, yes.
Implied.
Yeah, just don't write consent. It needs to be specific. What are the 6 components of the chain of infection? Yes.
Reservoir, exit pathway, entry, they're not in order. Entry pathway, suspectable host, infection, or I don't know which one that would fall under, and
The infectious agent.
there. And I can't remember the last one.
You said infectious agent, reservoir, exit pathway, a means of transmission? Okay. When you list them, they have to be listed in order on your test. What are the 3 of the, 3 of the 5 modes of transmission?
Airborne, contact, and droplet.
Yes.
Airborne.
Vector and vehicle.
And vector and
I'm
vehicle.
reading it.
Yep. What are 3 tubes that produce plasma?
PST.
Light green.
Yellow.
That's PST.
Just kidding, I was just testing.
Yellow. Yeah, sometimes I need a test. Believe me. Well, there's more than PST and yellow.
Now pink and purple.
Purple.
Pink and purple. And what about light blue?
I thought that clotted.
There's sodium citrate in the light blue tube. That keeps the blood from clotting.
Right in front of it.
What about PPT? What about your heparin sisters? They'll be really sad if you don't include them.
Lithium
Green?
heparin.
Mm-hmm. Two main tiers of precaution are
Standard precaution and standard. There's one with
UP.
universal precaution.
well, because remember standard and universal were like the same thing.
Standard.
Airborne precautions, you know, the different.
The two.
Just start with a T.
Mm-hmm. You have one in your car.
Transverse.
Not transverse.
Transmission.
You might have a transverse, but I
I
wouldn't.
got it. I got it.
You got
Transmission.
transmission.
It trans somewhere.
Yeah, that was good.
The transmission good too.
And I don't know what a transmission looks like, but I know that every car has one.
It controls
Based.
when you go out and drive and
And they are
reverse.
not. No. No. Which type of precaution would be used for a patient who has pulmonary tuberculosis? They're coughing.
Airborne?
Yes. Yep. What precautions are used for a patient who has an enteric pathogen?
Contact?
Yes. Contact. What is the normal I know some of this we haven't gone through yet, but what is the normal composition of blood?
The 3 parts? Is that what they're looking for?
What's up? 45% plasma.
Yeah, 55% the white blood cells. and-
Everything else.
Yeah, right.
Yeah. Formed elements.
Formed
Concordance.
elements.
Yes. 3 main cellular components of blood are,
Red blood cells, white blood cells, and platelets.
yep. What color or colors is the SST tube?
It's the tiger top, right?
So
Red and gray.
well, yeah, red and gray, not tiger top. It's not a color.
Can you repeat that again, the question?
Let's see. What color is the
You
SST
got a
tube?
picture, but I couldn't say the color to save my life?
I call it camel red.
And I told you about the gold tube. This little guy. This little SST tube. It's like,
For babies.
yeah, it's just a smaller volume tube. Do you guys use these at Quest?
We
Jessica?
do. The PDSST, we call them PDs.
Yeah, we do too. PD Golds.
PD
Because
gold.
use them on difficult sticks or little kids or,
Old people.
old people.
You shouldn't really say old.
I know, because old could be anything.
Elderly.
Yeah.
Youth challenged?
There you go.
That's good. There are days, I swear.
That could apply to anybody though.
It could. Why do we use a tourniquet?
To help the see the vein.
Easier to palpate.
To pull the blood.
To pool the
Pull
blood.
the blood, yeah.
But
But
Uh-oh.
can you say that any differently? Because it's not going to say to pool the blood on it's not
stop the flow.
To stop the flow of blood.
Oh,
It's like what a
To
tourniquet
decrease.
does. To decrease.
the flow of blood to the lower part of the arm.
Hold on, did we do the,
What?
Wait, what chapter are we even
okay, she
on?
said below.
To the lower arm.
Too big.
Name 3 tubes that have silicone gel.
SST, PPT, and PST.
Yeah. Very good.
Is the SST there?
Very good. I'm impressed. Name 3 departments the red tube can go to.
Serology, chemistry. Yeah, chemistry.
Yeah.
Those 2. And then blood bank.
Yes. Blood can be prevented from clotting by adding a substance called what?
Anticoagulant.
Anticoagulant.
And you asked me this over the weekend. Enteric pathogens fall under what precautions?
Wait,
Contact.
Contact. Which type of cell destroys pathogens by phagocytosis?
I'm sorry, can you say that again?
Oh, white
White blood cells.
Which type of cell destroys pathogens by phagocytosis?
White blood cells.
And specifically neutrophil. But we're going to go through that in the chapter.
Do they have to say neutrophil on the test? Or can they say
White blood cell will work. Tests that potentially pose insignificant risks to patients if errors occur in the test performance are called.
Say that one more time, please.
Tests that potentially pose insignificant risks to patients if errors occur in the test performance are called, this was back in chapter 1, I think. Well, there could be. There is,
Before or after the blood draw?
no, it has nothing to do with the blood draw.
In general.
Waved tests. Remember the wave tests? Some that pose a significant amount of risk, some pose not so much risk or a little bit of risk. Three behaviors that are involved in professionalism. Yes, you got that one.
Integrity,
Yes.
and then not compassion.
Professionalism.
Yes.
First one.
Do they specifically say professional appearance?
It says image, so that would work. I would accept that. What tests are run in the coagulation department? Specifically, what blood tests are run in coagulation?
Proton.
Yes. I think that's the only one that we're doing, that we know so far. Proton. A CBC, differential, and hematocrit are performed in which department?
Hematology.
Yes. Which body organ is targeted by HBV?
The liver.
Liver.
And what does HBV mean?
Hepatitis B virus.
Yes.
Hepatitis B.
What is homeostasis?
The clotting.
No.
No,
That's hemostasis.
Oh,
Your body.
Is that like
Don't get them confused.
The inside of your body.
The balance, yes.
The
State
balance
of
between-
equilibrium, yes.
I should know that one.
Hmm?
I suffer from vertigo every once in a while.
Oh, yeah?
Not a pretty sight.
What is normally found in the plasma portion of blood?
Starts with an F.
Visagen.
Fibrinogen.
Yeah.
I don't know why I have something different here, but I do.
Fibrinologian.
No. Another name for an RBC?
Red blood cell.
Blood cell.
Site.
Erythrocyte. Another name for WBC? Yes. What do you call the area in the front of the elbow?
Antecubital. Antecubital fossa.
Fossa. Yeah, and a cubital fossa. What is the process that by which the body stops the leakage of blood after injury?
Hemostasis.
Yes. I know it's easy to get those two confused.
Well, I fall over.
Hopefully you don't fall over from hemostasis. The heart, lymphatic organs, and blood vessels are in the what system?
Circulatory.
Yeah, but on the test it doesn't say circulatory.
Vascular.
Yeah, cardiac.
Cardiac.
Cardiovascular system. Yes.
Just think of when you're doing exercise, your cardio.
Yeah.
Your cardio, yeah.
Yeah.
Which I have to do that. What is CPR?
Cardiopulmonary.
CAP?
College of American Pathologists.
Invasion of privacy?
One's violation to be left alone.
QNS?
Quantity not sufficient.
TAT?
Turnaround.
CCU?
Coronary care unit.
Coronary. Coronary. You won't find cardiac on your test. It'll say coronary. Whatever, but that's what it's going to say. Cytology.
Study of cells.
The study of the cells.
And tissue.
And
Structure.
Structure,
Yeah.
cell structure.
To diagnose malignancy. Consent.
Permission.
To give permission. CDC.
Center for
Center.
Disease
Disease Control.
Medicaid.
Federal,
Program
state,
aid.
program.
Or the port.
Yes. PPE.
Personal protective equipment.
Tort.
Circle around.
Thank you.
FUO.
Fever of unknown origin.
Yes. Hematology.
Study of
Liver,
like
blood.
HIPAA.
Health Insurance Portability and Accountability Act.
Yes. CSF.
Cerebral spinal fluid.
NAACLS.
National. It's like national.
National Association of.
It's not the abbreviation. Agency that
Certifies
Certifies for bottom
programs.
programs. Yes. Not schools. Yes. Inpatient.
Hospitalized.
Hospitalized.
Yes.
Yeah.
OSHA.
Would you say inpatient would be
Ambulatory.
non-ambulatory?
Yeah. OSHA.
Security, safety of employees.
Or do they want the
Occupational
definition?
health.
Not the definition. They want the
Occupational
what it stands for, the
Health and
abbreviation.
Safety Administration.
Yes. Histology.
Study of the microscopic structure of tissues.
Yep. ICU.
I see you too.
Intensive care.
Oh, you're so funny. That's not the answer, though.
Intensive care unit.
Yes. Proxemics.
The study of the
One space.
Perception of
space.
Perception of space. Yes.
perceptions.
MSDS.
Material data safety sheet.
Yes. Coagulation.
Clotting.
Clumping together of blood cells that form a clot. Arterials.
Branches of arteries.
Yeah, they're small. Small branches of arteries. Yeah. Very good, very good, very good. Are you feeling good about this next week?
No.
But this
I'll be
little
feeling
pop
better
quiz is
next
good because
Friday.
now we know where we need to focus our efforts.
Yes.
Basically everywhere.
Right?
I did like one. I thought we were gonna do like 1 through 5 on the test, but then 1 through 6, it's like.
Okay. Hematocrit and hemoglobin, what two?
Purple.
A CRP, C-reactive protein.
Yellow.
No yellow. Red?
SST already?
Yes. Lipase. No.
SST or PST?
Yes. Epstein-Barr virus.
SST or red.
Yes. Drug analysis?
Red.
Said right?
Red.
No. Yes, purple. Type in RH.
Red.
Purple, red, yellow.
Oh, that's the different colors, right?
RH, what thing?
Yellow, red.
Red.
Purple, pink.
Very good. CBC?
Purple.
Cholesterol?
SST or PST.
PT, protein?
Light blue.
Glucose?
Gray.
Gray.
CMP?
SST, PST?
We have to call them SSTs though. We don't call them Tiger Tops anymore. Yeah. That's okay. I know it's hard if you've been doing it your whole life and then you have to change it. It's not easy. Fibrinogen.
Light blue.
No green.
Light blue.
Light blue. Electrolytes.
SST or PST.
Antibody screen.
Purple, pink.
Purple, red,
Bunch of them.
pink, purple.
Pink, purple, red.
This have to be in the
yellow.
order? Like.
No, but you have to name all 4 of them. Yeah. Yeah. Okay, guys. We'll go ahead and take a break for about 15 minutes, and then we'll come back and draw, and then we'll